I'm Dr. Kalpana Nagpal, Senior Consultant in the field of ENT and head and neck surgery and robotic surgery at Indraprasth Apollo Hospital, New Delhi. Basically, I would like to tell you all about how safe robotic surgery is during this pandemic. Now, COVID-19 pandemic has changed lives for everyone. Similarly, even the surgeries and the theater, a lot of changes that we brought in for better safety. So in Apollo, we follow certain protocols for safety measures, like both anesthesia and surgery. We have set laid protocols, and that's being followed from the beginning of the pandemic. Now, instead of traditional surgeries, robotic surgeries seem to be much safer during this pandemic. Now, I will tell you why. See, in robotic surgery, the surgeon is operating several feet away from the patient. So the surgeon is sitting in front of the surgeon console, which is several feet away from the patient. And the robotic arms, which are inside the patient, are sterilized. And there is no direct handling of tissues. So the entire surgery is being followed by surgeon's command, which is given at the console, and that is being translated into the movement of the tips of the robotic arms. Similarly, the nursing assistant or the junior doctor who is assisting the surgery, they're sitting near the patient, but they're not touching the patient in any form. So robotic surgery that is why safe. You're not handling the tissues and you're not exposed directly to the COVID virus load. See, everybody undergoes a RT-PCR testing before the surgery or before admission. And of course, when they're negative, except for emergencies, we do take the patient only when the COVID is negative. Now, despite being negative, we're not 100% sure that the patient doesn't have COVID. So they can be asymptomatic patients who have COVID infections. And mind you, the COVID virus load is maximum in the regions of upper airway. That is, in the nose and the throat, there is maximum viral load. So that is why robotic surgery in this area becomes much safer. Also, robotic theaters are basically negative pressure units, and the suction fumes are all evacuated. There is a special smoke evacuation system. So the distance from the patient and as well as the surgeon evacuation system and the other safety protocols that we follow by wearing PPEs, etc., which is actually less required in a robot-assisted surgery, but yet by maintaining all these protocols, the surgery becomes very safe for the patient as well as for the healthcare workers. Now, this is a great way of ensuring that the COVID-affected people are much less following these kind of surgeries. Thank you.